Help us all down here on Earth. Michael George shows us how.
Most of us have been sleeping really well.
How the astronauts sleep in space and perform is one of the health studies underway aboard Artemis II.
For me, sleeping in space is one of the most comfortable ways to sleep, and it's very deep sleep.
The astronauts are wearing special watch-like devices that provide data about their sleep cycles and the quality of their slumber.
It's really important to help us figure out how their psychological well-being is. And so we have questionnaires and surveys asking them how they're feeling, how they're doing, what's the team dynamic like.
Soon after the astronauts return to Earth, they'll take part in an obstacle course. Their performance will give clues about how NASA should proceed when the space agency again lands a crew on the moon, scheduled for 2028.
We can understand how well they can function, how well that inner ear is working, and whether or not they will need to rest some before they can go out and do their work.
Another study, called Avatar, has brought the astronauts' bone marrow cells aboard the Orion spacecraft.
We get to answer so many questions in this small package of an organ chip model, and the power of it's going to be incredible.
Providing their own medical data is part of an astronaut's commitment to science.
All of the astronauts that have flown in space, you become a test subject for the rest of your lives.
Scientists are also monitoring radiation levels and will use saliva samples to evaluate astronauts' immune systems in deep space. Michael George, CBS News.
Checking in. Also fantastic. The results of the program should start to be released a month or two after the astronauts return to Earth. And we will have special live coverage as the Artemis II crew splashes back down to Earth. A team of journalists with our sister stations will join you at 7 p.m. You can even text them your questions to the number on your screen. It's 704-329-3600. The actual splashdown is set to happen just after 8 p.m.